Hello, ladies and gentlemen. I'm Harriet Mpairwe, a clinician and epidemiologist at the Medical Research Council, Uganda Research Institute, and I'm also an assistant professor at the London School of Hygiene and Tropical Medicine. So my leadership project is entitled Improving the Health and Wellbeing of Professional Women through Increased Physical Activity in Uganda. Professional women are least physically active, and there are a number of reasons for that. One is that due to the work on computers, motorized transport, and multiple roles that they juggle, work, family, household, and care duties, these all combine to make it difficult for them to achieve the required physical activity levels. And yet we know physical inactivity is a leading risk factor for non-communicable diseases such as heart disease, stroke, diabetes. All these kill 41 million people annually globally. So my project goal is to support professional women incorporate more physical activity into their busy schedules. So my project objectives are to conduct a cross-sectional study to assess their current physical activity levels and to identify the key enablers and barriers to physical activity in Uganda. And the second objective is to pilot and optimize the use of physical activity manual that I've developed as a tool to increase physical activity among women in the corporate work. So why I chose this project is I'm passionate about physical activity, and because this affects everyone and increases the quality and length of life. And I'll be able to leverage new skills from the training from the WomenLift project, such as peer-to-peer counseling, with my own research training to successfully conduct this project. And I know that this project will enable me to lead this kind of research at my institution and in the country at large. So I developed this manual as part of my leadership training journey and entitled it Physical Activity Manual for Busy Women in the Corporate World, Your Exercise Guide to a Healthier You. And the journey, the process of developing this manual involved identifying key issues with regards to physical activity, and through discussions with my friends and colleagues. And I was particularly interested in finding out the barriers and enablers for physical activities for those that are able to do physical activity. And part of this work involved me conducting extensive reading and research on this topic so that I have the current information to include. And all this combined, I was able to develop this manual, and the main topics include the following. One, benefits of exercise. This is mainly to inspire action, because once you know what you're going to get out of this, you're more motivated to exercise. The recommended physical activity levels, because many people didn't seem to know how much activity is enough or is recommended per week. So that is included. The different types of exercise and what their benefits are. This is to inform you so that you know that you're doing the right exercise for the kind of goals that you have for yourself. And the other topic is personal activity plans and workout templates. These templates people will be able to download and fill in so that they keep monitoring and keep motivated to keep on this journey. And I also include practical ways to increase physical activity while at work. So the progress to date is that I've been able to complete all the 7 activities according to these charts, the activities. And what is pending at the moment is submission of the protocol for ethical approval so that I can be able to to obtain consent and collect the baseline data, and thereafter optimize and test this manual in the real world. So all these activities that are pending are going to commence in 2026 in the first quarter. So what have I benefited from the projects and leadership in terms of growth? One, I have achieved alignment between my own passion, my lifestyle, my career, and my business ambitions. And this is how I will maintain momentum for this project and for leadership, for my leadership journey going forward. I have found the courage to find my own career path and follow it, and I will be able to support others who are on a similar quest. And I've got to author this book that will inspire others to act for better health. I thank you all for listening.